Hello students. Drawings help you to understand a topic better and also help you with an enhanced recall. So let's today draw 3 diagrams of inguinal region which are going to help you to understand the inguinal region completely. Are you ready? Let's begin to draw the first diagram. Here's the anterior superior iliac spine and here is the pubic symphysis. Label the pubic tubercle clearly. Now take a green colored pen and draw a line extending from the anterior superior iliac spine to the pubic tubercle. This is your inguinal ligament. Draw a triangle above it, the superficial inguinal ring. Okay, label it well so that as you draw, you begin to remember and understand things. Here now you will draw the deep inguinal ring, which is a gap in fascia transversalis. Now join the deep inguinal ring to the superficial inguinal ring with the help of 2 lines. So this is the first line and this is the second line. This is the inguinal canal extending from deep ring to superficial ring. It is related to some muscles. Let's draw those. Okay. So now starting from the lateral 1/3 of inguinal ligament, arching over the inguinal canal is the internal oblique muscle. Completed. Okay. Passes to get attached behind the superficial inguinal ring to the pubic bone. Deep to this lies the transversus abdominis. Let's try and draw that as well. So now draw the transversus abdominis arching in a similar manner. Remember to ensure that the fibers pass over the transversus abdominis and not in front of it. Now how do we differentiate these two? Differentiate them by coloring first the transversus abdominis and then take another pen and color the internal oblique over this. Okay. As you color over it, you begin to realize how transversus is a deeper muscle, internal oblique is a more superficial muscle. Both the fibers meet medially and get inserted on the pubic bone, forming the conjoint tendon. Label it. Now, only structure left to be drawn is the inferior epigastric artery. Okay, this is an artery that passes posterior to the inguinal canal in such a way that, let's draw it. Take a red colored pen and draw the inferior epigastric artery. Now you color it and then you make it dotted. Why dotted? Because like I was saying, it passes deep and then later medial to the deep inguinal ring. It is not crossing the inguinal canal from the front. Label it now. That's the inferior epigastric artery. This is a simple diagram that helps you to understand the concept of inguinal canal. Now I'm going to take you to another diagram which helps you to understand the concepts of roof and floor of inguinal canal. So let's begin by first drawing the skin. Deep to the skin, you know, is the superficial fascia, fascia of Camper. Draw it nice and thick. And deep to this is the fascia of Scarpa. Draw that as well. Now deep to this, I want you to draw the external oblique aponeurosis, fibers of which curve inferiorly to form the inguinal ligament. Deep to this now you will find the internal oblique fibers. You can see how near the inguinal canal they arch above the inguinal canal. Deep to this, draw the transversus abdominis, whose fibers also arch together. The two muscles meet posteriorly to together form the conjoint tendon. Draw this and now label it well. And there is your inguinal canal. And now let's add the contents. This is the spermatic cord and here below is the ilioinguinal nerve. Okay, so that is your inguinal canal and its contents. Draw the fascia lata. Draw the pubic bone to which the inguinal ligament is attached. Okay, a little bit of shading to give it that feel. Now let's add the fascia transversalis posteriorly, the extraperitoneal tissue that lies behind it, and the peritoneum. So students, you understood by this simple diagram how the roof is formed by transversus abdominis and internal oblique arching fibers, and the floor is formed by the curving fibers of inguinal ligament. Very simple diagram but gives you the concepts clearly. This muscle is the pectineus, which also you can add to your diagram. So this was the second diagram which helped you understand the concept of roof and floor of inguinal canal. Let's now go to the third diagram, which is very diagrammatic but helps you to understand what are the structures that form the anterior wall and the posterior wall of inguinal canal. I want you to begin this by drawing the skin here. Deep to that, as usual, the superficial fascia, that is the fascia of Camper. Take your time, enjoy yourself. Okay, don't think of this as another job to be done. Deep to this will be the fascia of Scarpa. Now take a green pen and draw the external oblique aponeurosis. Okay, so begin to draw it medially and leave a triangular gap in it, which is the superficial inguinal ring. Now let's take up a blue pen or whatever you like and draw the fascia transversalis with a deep inguinal ring gap in it. Okay, so now you got your two rings in place, deep and superficial. Now we will connect them to form the inguinal canal. So draw two lines, one extends from deep ring to the superficial ring, the other as well, and here is your inguinal canal. Okay, so now we have to understand who forms its anterior wall, who forms its posterior wall. So for understanding the anterior wall, we will need to draw the internal oblique muscle as shown here. Okay, and a little bit posteriorly to it, a small transversus abdominis muscle is to be drawn. Now, the simple diagram shows you muscles and structures forming anterior wall of inguinal canal. Let's now go to structures forming posterior wall, which is the conjoint tendon. As you recall, tendon formed by union of transversus abdominis and internal oblique, and a little anterior to it, reflected fibers of inguinal ligament. So you saw how the posterior wall, yes, you color it, and then you can see posterior to this, the extraperitoneal tissue. Posterior to this, draw the peritoneum also clearly. You will draw the inferior epigastric artery here, deep to fascia transversalis, medial to the deep inguinal ring. Remember, any hernia medial to this will be the direct inguinal hernia. Any hernia lateral to it will be the indirect inguinal hernia. Thus, students, you saw how simple three diagrams will help you to understand most of the anatomy of inguinal region very well. I hope this has helped you, students. Let's see you across the screen in some other video. Thank you.